Thank you very much for inviting me to be here today. So my topic is on chronic intensive care related pain, a call for action. I'm going to start off by looking at this chart. Here you can see the ICU admissions in the United Kingdom from 2012 to 2018. You can see that there was an increase in those 6 years. And bear in mind that I have not included ICU admissions due to COVID-19 yet in the past year. So why is it that admissions to the intensive care unit has been increasing? Well, here in the United Kingdom, we have an aging population. So there is an increased prevalence of chronic conditions. In fact, the National Institute of Aging has said that 85% of older adults have at least one chronic condition, and 60% of these adults have two chronic conditions. But beyond that, we also know that ICU serves as a place that patients are transferred to following really specialized and complex procedures. And we know that as medicine advances, more of these complex procedures will be devised, and that creates a growing demand for the intensive care units in the near future. In fact, the NHS England has already stated that despite the high costs associated with building and maintaining these ICUs, to meet that growing demand, they'll have to supply more in the near future. So a bit of background into ICUs. The photo you see on the right is of Florence Nightingale, and the concept really started with her in the 1850s during the Crimean War. She separated the more severely injured soldiers and placed them closer to the nursing station so she could pay greater attention to them. Decades later, we've made great strides in the field, and now we have levels corresponding to the degree of organ support required by a given patient. Despite severity of illnesses increasing, we've become much better at managing and treating these conditions. In 2019, 76% of patients were discharged from the intensive care unit to the ward. But my question is, how has that impacted their quality of life? Are the patients who were discharged really living their life, or are they purely surviving as a result of our extreme medical interventions? By the end of this presentation, I hope you'll understand the importance of addressing chronic intensive care related pain and some ways in which we can do this. So pain is defined as an aversive sensory and emotional experience, typically caused by or resembling that caused by actual or potential tissue injury. And it can affect several domains in one's life. So physical function, professional life, personal relationships, social life, and mental health. Pain is deemed to be chronic if it exceeds 3 months in duration. So in the context of an ICU, 3 months after discharge from the intensive care unit. And there is a bit of literature on chronic post-surgical pain, but what I found quite baffling is that the intensive care unit also holds quite invasive measures and interventions in order to keep people alive. Yet there's really a paucity of literature and research in this field. But what's really important to note is that the prevalence of chronic pain in these ICU survivors can reach up to 77%. So you can see that a significant proportion of these people who have been discharged from the hospital are actually leading their lives with a really debilitating condition. Post-intensive care syndrome, abbreviated to PICS, is defined by the Society of Critical Care Medicine as new or worsening problems in physical, cognitive, or mental health status arising after a critical illness and persisting beyond acute care hospitalization. So the reason I included this is because there seems to be links between pain and the development of chronic pain and some of these aspects. So if I examine the mental health status a bit more, post-traumatic stress disorder, or PTSD for short, appears to be in some bidirectional relationship with chronic pain, in which the incidence of PTSD diagnoses is actually higher in a chronic pain population compared to those without chronic pain. And if we examine the war veteran population, we know that based on their experiences in war, they have a higher rate of PTSD. And did you know that 60% of them actually developed chronic pain afterwards? So there appears to be a really inextricable link between these factors and chronic pain. But we can apply what we know here to our current situation with COVID-19. Because we know that a lot of healthcare professionals wore PPE, personal protective equipment, in order to safeguard themselves and protect the patients. But that also further alienates patients. It creates a sense of divide, a sense of them and us. And that could predispose those people beyond their physical ailments to developing mental health illnesses. And if it is true that mental health conditions are linked to the development of chronic pain, then it is also possible that they are at an increased risk of developing chronic pain after intensive care admissions and hospitalization. Despite the limited research out there, there have been some factors mentioned that may contribute to chronic pain development in the context of ICUs. I've divided these into various factors. So patient-specific factors, older age has been shown to carry an increased risk of developing chronic pain. And that is likely due to the higher prevalence of chronic conditions. It's already very difficult to adequately manage this high prevalence of chronic conditions in the population. But I would imagine it's even harder to do so in an acute setting. Then there are ICU-related factors. A prolonged ICU stay is associated with an increased risk. And that does make sense if we think about it, because a longer ICU stay is associated with a greater severity or complexity of illness. No one stays in the ICU because they want to. And there's also associated with a longer period of immobilization. And we know that that can lead to muscle atrophy, so that's muscle wasting. And that can cause musculoskeletal pain and conditions later on. Abrupt cessation of opioids or misuse of opioids can also lead to hyperalgesia, which can lead to chronic pain development. And then there are some disease-specific factors. I'm focusing on the diseases that are highly prevalent in the ICU. Sepsis is one of them. A German cohort study showed that in patients who had sepsis, they had an increased sensitivity to pain. And then there's acute respiratory distress syndrome, ARDS. And it is hypothesized that the long-term ventilator use in these patients is the reason that chronic pain develops. But it's really important that we investigate this further in the near future, because we know that a phenotypic presentation of COVID is very similar to that of ARDS. And if it is true that ARDS increases the risk of chronic pain, then we know, based on the surge in ICU admissions in the past year attributed to COVID-19, we may be anticipating epidemic levels of chronic intensive care related pain as a result. Future directions. As I said, there is really very little in research on this topic, and our lack of understanding into how chronic pain really develops in this population warrants further studies, both clinical and scientific. From a scientific perspective, if we can understand how chronic pain develops in this population, then we will be able to mitigate the risk of that. And from a clinical perspective as well, if we can conduct more prospective cohort studies to try and understand to what extent pain mediates between the different aspects of PICS, so the physical aspect, the cognitive, and the mental health aspects, and would alleviating one of these conditions reduce the prominence of the other in one's life? So these are questions that have yet to be answered. And we also need a greater focus on pain as a primary measurement, rather than something that's just ad hoc and just casually mentioned into other bits of literature and research. And personalized pain management program. So if we translate our findings from the war veteran population, they have a very tailored pain management program that's exclusively for war veterans. And it was found that not only did their pain improve, but psychological aspects did as well. So it is possible that if healthcare professionals adopt a more specialized approach to pain in this particular ICU population, it may yield more positive and better results than just purely going through normal rehabilitation programs. And finally, public awareness. The ubiquitous nature of social media should really be harnessed to our advantage at this stage. Healthcare professionals can advocate for patients who they've seen and patients who cannot do so themselves, and talk about what some of the impact of this really debilitating conditions on the patients who they see on a regular basis. And survivors should also speak out to raise the profile of this condition. This will inevitably improve funding for the cause, and more research would be able to be conducted. So there's a bit of a loop here. Several news outlets have already talked about post-intensive care syndrome in COVID-19 patients, how their journey did not end at just discharge from a hospital. So it shows that this is a really topical issue at the moment. And as a result, researchers have addressed this, called for formally addressing post-intensive care syndrome to higher organizations such as the World Health Organization. So it shows that this has the impact to really change our lives in the next few decades. In conclusion, chronic pain is highly prevalent amongst ICU survivors. It may also be interrelated to other aspects of post-intensive care syndrome. There are several factors that may contribute to pain development, including ICU factors. But the problem is there is really a paucity of research in this field, and it is incumbent on us to act now. Because if we think about the number of people who have been hospitalized and sent to the ICU due to COVID-19 in the past year, and imagine 77% of those people developing chronic pain, in addition to those before COVID even hit this earth, it will burden the NHS more than it can take. I would like to end on a quote by Abraham Lincoln, and he said, "In the end, it is not the years in your life that count. It is the life in those years." Thank you very much for listening.